Welcome everyone to an in-depth look at a rare and complex congenital heart defect, pulmonary atresia with intact ventricular septum, or PIVS. This condition, present at birth, profoundly affects blood flow, demanding immediate attention and long-term management. Join us as we explore the causes, symptoms, diagnosis, and treatment options for this challenging heart condition. The precise cause of pulmonary atresia with intact ventricular septum is not fully understood. Like many congenital heart defects, it's believed to arise from a combination of genetic and environmental factors during the critical early stages of fetal development. These factors can interfere with the normal formation of the heart's pulmonary valve, leading to its complete closure. Research is ongoing to pinpoint specific genes and environmental exposures that may increase the risk of PIVS. Now, let's delve into the inner workings of the heart affected by PIVS. Normally, the pulmonary valve allows blood to flow from the right ventricle to the pulmonary artery, which carries it to the lungs for oxygenation. In PIVS, this valve is completely blocked, preventing blood from reaching the lungs through the usual route. Furthermore, the ventricular septum, the wall separating the heart's lower chambers, is intact. This means there's no direct pathway for blood to shunt from the right ventricle to the left. To survive, babies with PIVS rely on a fetal blood vessel called the ductus arteriosus, which connects the pulmonary artery to the aorta. This vessel allows some blood to reach the lungs, but it naturally closes shortly after birth. Without intervention, the baby won't receive enough oxygenated blood. Pulmonary atresia with intact ventricular septum is a relatively rare congenital heart defect. It occurs in approximately 1 in 10,000 live births. While it affects both males and females, some studies suggest a slightly higher incidence in males. It's important to note that PIVS represents a small percentage of all congenital heart defects, highlighting its rarity compared to other heart conditions. The signs and symptoms of pulmonary atresia with intact ventricular septum are usually evident shortly after birth. Cyanosis, or a bluish discoloration of the skin, is a primary indicator, resulting from insufficient oxygen in the blood. Babies may also experience rapid breathing, difficulty feeding, and lethargy. In severe cases, they can develop heart failure, characterized by fluid buildup and difficulty breathing. The severity of symptoms depends on the degree of pulmonary valve obstruction and the adequacy of blood flow through the ductus arteriosus. Diagnosing pulmonary atresia with intact ventricular septum typically begins with a physical examination, where a doctor will listen for heart murmurs and assess the baby's overall condition. An echocardiogram, a non-invasive ultrasound of the heart, is the primary diagnostic tool. It provides detailed images of the heart structure and function, confirming the absence of the pulmonary valve and the intact ventricular septum. Additional tests, such as an electrocardiogram, ECG, to assess the heart's electrical activity and a chest X-ray to visualize the heart and lungs, may also be performed. Cardiac catheterization might be necessary to precisely map the heart chambers and blood vessels. Pulmonary atresia with intact ventricular septum is often classified based on the size of the right ventricle. In some cases, the right ventricle is small or underdeveloped. In other instances, it may be of normal size or even enlarged. The presence of ventricular, coronary artery fistulas adds another layer of complexity. These abnormal connections between the right ventricle and the coronary arteries can potentially lead to complications. Treatment for pulmonary atresia with intact ventricular septum is crucial and requires immediate intervention. The initial step is to maintain or reopen the ductus arteriosus with medication, usually prostaglandin E1. This keeps blood flowing to the lungs while further treatment is planned. Depending on the specifics of the baby's condition, treatment options may include a surgical valvotomy, which aims to open the pulmonary valve, or a shunt procedure, which creates an artificial pathway for blood to reach the lungs. Some patients require a more complex surgery called the Fontan procedure, which reroutes blood flow to bypass the right ventricle. Regular follow-up with a cardiologist is essential to monitor heart function and manage any complications that may arise. Currently, there is no known way to completely prevent pulmonary atresia with intact ventricular septum. However, women planning to become pregnant can reduce the risk of congenital heart defects in general by maintaining a healthy lifestyle, including taking prenatal vitamins with folic acid, avoiding alcohol and tobacco, and managing any pre-existing medical conditions such as diabetes. Genetic counseling may be recommended for families with a history of congenital heart defects. The prognosis for babies with pulmonary atresia with intact ventricular septum has significantly improved in recent years due to advances in surgical techniques and medical management. While the long-term outlook varies depending on the severity of the condition and the effectiveness of treatment, many individuals can lead relatively normal lives, Recent research focuses on improving surgical outcomes, minimizing complications, and developing less invasive procedures. Additionally, studies are exploring the genetic factors involved in PAI-IVS, potentially leading to better prediction and prevention strategies in the future. Continued research and advancements offer hope for improved outcomes and quality of life for individuals affected by this complex heart condition.